So this semester we focused on maternal breastfeeding and how to increase breastfeeding outcomes based on intent, initiation, duration, and exclusivity. Our research proposal is titled Evaluating the Efficacy of an Online Breastfeeding Intervention, Effects on Maternal Intent, Duration, and Exclusivity Among Mothers and Spouses in San Francisco. My name is Jacqueline, and my research partner Laura is also on the line today. So first we'll start with an introduction. So the CDC recommends newborns to be breastfed exclusively for at least the first 6 months of life, and after that, up to a year or 2 years of life after, while introducing other complementary foods into their diets. So breastfeeding provides many important health and nutrition benefits for infants and newborn mothers. For infants, it's their main source of nutrients coming after birth. And then second, it also helps with their immune system development. And infants who are breastfed are shown to have reduced risk of asthma, lower respiratory disease, lower risk for obesity, type 1 diabetes, as well as ear infections and gastrointestinal infections. And with the development of their immune system, they've been shown to have better reactions to vaccines as they get older. For mothers, breastfeeding can help lower the mother's risk for high blood pressure, type 2 diabetes, ovarian cancer, and also breast cancer. And so, with all these health and development benefits of breastfeeding, the CDC has found that the rates of breastfeeding are lower than expected. So, as of 2019, only 55.8% of infants received breast milk, and of that percentage, 24.9% received breast milk exclusively. And so, there are many factors that can contribute on the decision to initiating or also discontinuing to breastfeed. And we touch on a lot of these in the next slide. But we wanted to ask the question, can providing a breastfeeding-focused program increase initiation rates, duration, and exclusivity among mothers? And so we did a lot of research for the literature review, and a lot of these studies that we looked at were mostly observational, and they were based on surveys and interview formats that followed mothers after they gave birth, and they were really able to understand the drivers that affected breastfeeding. And so there are four main categories. The first is economic background. In general, high economic and high education attainment led to job mobility and more stability, which increased rates of breastfeeding among working mothers. In terms of social dynamics, professional and personal circles had an influence on whether mothers breastfed or not, and oftentimes workplace paid family leave and also resources like lactation rooms positively impacted breastfeeding outcomes. In terms of breastfeeding education, there was a lot of sources where mothers could get information from, and there was a lack of consistency in material being shared and also the sources where they were getting information from. And lastly, maternal health encompassed mental health and medication use. Um, and some studies found that maternal depression, anxiety, and childbirth trauma correlated with an early cessation of breastfeeding. And so, despite all of these studies and the numerous studies, we found that there was a gap on accessible educational intervention programs and resources that were available to both mothers and their partners to influence breastfeeding outcomes. And so in our research, we found that it was really important to also include the partner's support, and that played a role in the decision to breastfeed and often led to longer breastfeeding duration as well. The second point was that there was a lack of research that controlled variables like income and working status and geographic location among mothers. And the reason is because a lot of these studies relied on data from surveillance programs that were funded by the USDA and the CDC. And oftentimes these were large, widespread surveys. And so it was really hard to pinpoint specific causation or links between um, a specific factor and influencing a breastfeeding outcome like initiation, duration, or exclusivity. And so in this study, we wanted to focus on an educational interventional program, and the two objectives that we wanted to investigate are one, quantifying breastfeeding outcomes based on initiation, exclusivity, and duration for the two groups of mothers. The first group is those who participate in an early education program, and the second group is the mothers who did not participate in an early education program. The second is to identify additional barriers to breastfeeding, and this will be among a smaller test group population, and those including exclusive and exclusive factors, and inclusive factors will be covered in a later slide. In this study, we have two hypotheses. The null is that participation in an early breastfeeding education program is not associated with improving breastfeeding outcomes among full-time working mothers and dual-income households. The alternative is that participation in an early breastfeeding education program improves breastfeeding outcomes among full-time working mothers and dual-income households. And I'll pass it on to Laura to discuss research methodology.
Thanks, Jackie. Next, we'll go over the research methodology. Our study has two parts. First, the quantitative portion, which is interventional, as it provides a breastfeeding educational interventional program. Comparative, as it compares breastfeeding outcomes for mothers that participate and mothers that do not participate in the study. Longitudinal, as it follows the mothers and infants over time, up to 12 months of age. The qualitative portion follows, which looks to understand why the intervention did or did not improve breastfeeding outcomes. Now we will break down the intervention and the groups involved. Here we list the inclusion and exclusion criteria for the participants. We were looking to really narrow down what moms and what their socioeconomic status was to control for those variables. So we chose an income that exceeded 250,000 for the two parents. And we identified that San Francisco would be a good city to explore. And then for the exclusion criteria, we excluded moms that are not employed or have part-time work, single mothers, moms that have infants with known health issues. We didn't want that to interfere with the data that we gathered from this. And mothers who are taking medications, as from our literature review, we identified that that could be a barrier to breastfeeding. And we wanted to explore adult established population, so we chose people over 20 years of age. Now we will break down the intervention of the groups involved. The control group will be the mothers and their spouses who follow their routine prenatal care without participating in our specific educational program. And the intervention group or treatment group will be the group of mothers and their spouses who will participate in our specific breastfeeding education program. The program will be delivered in a flexible online platform, but it will still track the participants' progress. And they will be provided with a final assessment that can be retaken as many times as they need. But they need to score greater than 80 on their final assessment to be counted as a participant in the program and the study. The data collection of the study is broken down as follows. So we have quantitative data, and it's binary for initiation, exclusivity of breastfeeding, and ordinal for duration of breastfeeding. The qualitative data will be placed into two categories, perceived barriers to breastfeeding, which will be coded qualitatively, and then breastfeeding intent and attitude will be collected via questionnaires that use a Likert scale. Now let's take a look at the statistical tests that we've chosen for our data analysis. So the chi-square will be used to determine if there's a significant association between the categorical variables for breastfeeding, like initiation rates, duration, exclusivity, against the participation in the breastfeeding educational program. The logistic regression will be used specifically to determine associations between binary outcomes and the participation in the program. So like intent to breastfeed would be a binary outcome. Ordinal logistic regression will be used to determine associations for ordinal categories like duration measurements and Likert scale measurements. Significance, the study assesses the effectiveness of an interventional program with a controlled population. Previous research has been generally focused on observational studies that looked at socioeconomic factors, diverse populations, work status, income, and it made it hard to identify specific correlations. So our study aims to provide a clear insight into the intervention's impact by limiting variability. Our novel interventional program aims to offer convenience and flexibility through online modules. The program covers breastfeeding health benefits for infants and their mothers, techniques, common challenges, and practical tips for managing breastfeeding with daily life. The content of the program will be developed and reviewed by relevant healthcare professionals.
And so this study does have a couple limitations. So the first is that the sample size is small. So again, this study controls variables such as geographic location by focusing on San Francisco, income level, and career status. And this is really just to understand the impact of the education program. So in the future, after this research is completed, additional studies will need to be conducted on groups of women working in different industries and at various income levels to identify other practical intervention methods. The second is reaching an adequate amount of recruitment and completion rates for statistical significance. And so we anticipate that there might be a little bit of difficulty to get numbers in the test group that are statistically significant. To work around this, we can extend the recruitment duration until we get that significant amount. But through this process, data and insight can be drawn to improve methods on sharing information or for better execution in the future.
So, in conclusion, the study closely looks at how an online breastfeeding education program for income full-time working mothers and their partners in San Francisco would impact breastfeeding outcomes. We hope that by targeting the specific group and controlling for socioeconomic factors, that this focused approach can be used to inform targeted public health strategies, with future research needed to adapt to other populations. Thank you.
Thank you.